Hello everyone. Our today's topic is we are going to discuss is the mycology. Which is all about the studying the fungal infections. So over the past decades, scientists have become more interested in it because it turns out fungal diseases they are more common than we thought. So in the past, people had a lot of wrong ideas about the fungal infection. But thanks to careful scientific researches, we have now know we now know that about a different aspect of mycology like how these infections spreads, how they make us sick, how our bodies defend against them and how doctors can find and treat them. Now let us discuss the various mycological infections. The first is the candidiasis. Well, the candidiasis, other name is candidosis, moniliasis, or the thrush. So, for entrance exam point of view, you have to just remember that another name of candidiasis is candidosis, moniliasis, or the thrush. The main culprit behind the candidiasis is a fungus that is known as, remember, that is Candida albicans. Right now, these Candida fungus, it can occur in three forms. What are they? Pseudohyphae form, yeast form, and chlamydospore form. So it likes to grow quickly in the warm temperature. The warm temperature that is between the 25 degree to 37 degrees. The Candida is actually quite common, found in the mouth, guts, and vagina of the clinically normal person. So normally it does not harm, but when the condition they are favorable, like when the immune system it is weakened, these fungus can transform into harmful form that is known as the yeast. So which is the harmful form? It's the yeast form that is harmful and that can invade tissues and cause problems. Now, candidiasis, remember for your entrance exam, the most opportunistic infection or in the word is the candidiasis, right? Now, candidiasis is known as opportunistic infection, meaning it take advantage of the weakened immune system. Its occurrence increases with the use of the antibiotics, which destroy the normally inhibitory bacterial flora, and immunosuppressive drugs. Immunosuppressive drugs like the corticosteroids, chemotherapy drug that can make people more prone to getting candidiasis. So it is a major problem for patient with the conditions like leukemia and the lymphoma. Now, oral candidiasis usually remains localized, but it may show extension to the pharynx or even to lungs with the fatal movement. Now, what are the two types of candidiasis? The candidiasis can be of two types. One is primary oral candidiasis and other is secondary oral candidiasis. So, the primary oral candidiasis, this type stays in the mouth and areas around it like the lips. It does not spread to other parts of the body. Whereas the secondary oral candidiasis, it is a manifestation of the systemic mucocutaneous candidiasis. Here the oral lesions or sores, they are the part of bigger problems affecting the skin or the mucous membrane throughout the body. So it is a sign of systemic mucocutaneous candidiasis, meaning the infection it is spreading more widely in the body. Now let us discuss the various types of candidiasis. It can be in acute form like pseudomembranous candidiasis or erythematous candidiasis, or it can be in the chronic form. Chronic form can be hyperplastic nodular plaque erythematous or the pseudomembranous form, or it can be associated with the candida associated lesions That could be denture stomatitis, angular cheilitis, median rhomboid glossitis. What are the keratinized primary lesions that are super infected with the candida? They can be leukoplakia, lichen planus, lupus erythematosus. So all these are example of that. Now let us discuss them one by one. The first is the pseudomembranous candidiasis. So pseudomembranous candidiasis, you will see these white patches as you can see here. These are the white patches. You will see white patches in the mouth, especially in the people who are already sick or have a weakened immune system. Other name of remember the other name of pseudomembranous candidiasis, it's the thrush, and it is the most common form of candidiasis. So which one is the most common form of candidiasis? Answer is pseudomembranous candidiasis. So this condition can happen at any age, but it occurs to more in people who are very weak due to illness or who are chronically unwell. It can also occur in the babies. So it might be a sign of weakened immune system, especially due to the HIV patients. So, so pseudomembranous candidiasis, it creates white soft patches around the mouth, as you can see here. So these patches, they are slightly raised and usually found inside of the cheek region and the tongue, but they might also appear on the roof of mouth, gums, or under the tongue. So these patches, remember, they appear as curled milk appearance. And what are they made up of? They consist of, remember, tangle mass of fungal hyphae with intermingled desquamated epithelium, keratin, fibrin, necrotic debris, leukocytes, and the bacteria. Now remember, important is that white plaque can usually be wiped away with a gauze. So when you take a gauze and wipe it, it can be easily wiped off. So having a relatively normal appearance mucosa or erythematous area. Other form is erythematous candidiasis. What is other name of erythematous candidiasis? Remember, it is also known as antibiotics or mouth. So what is erythematous candidiasis? It is also known as antibiotics or mouth. So it usually occur as sequel to broad spectrum course antibiotics, corticosteroids, or any disease which suppresses the immune system, more commonly the HIV diseases. So it may include the central papillary atrophy of the tongue. So the main characteristic of this disease is that instead of the white area, you will see uh, the affected area here looks like a red in appearance, right? If the metas means red. So the redness here is because of more blood supply flowing there. So doctors can tell the difference between this and another condition that is known as hydroplakia, because the erythematous candidiasis, it has a softer edges. So the edges, they are softer here and is not clearly defined. Also, unlike the other type of candidiasis, remember this one is consistently painful. That is important for your entrance exam. Now the central papillary of tongue, it is a red patch on the back of the tongue that looks red because it has a missing filiform papilla. So this tongue issue is often linked to chronic smoking or due to presence of Candida albicans. Sometimes the back part of your roof of your mouth, it can get red due to contact with the tongue lesions. So that is known as a kissing lesion. The next is the chronic hyperplastic candidiasis. It is also known as leukoplakia type of candidiasis. So this is a chronic hyperplastic. So this kind of candidiasis, it creates a firm white patch that sticks around for a long time. So these patches are usually found on the lips, tongues, and inside of the cheeks. So scientists, they have found a strong connection between the type of candidiasis and changes in the cell structures in these white patches. Some some scientists may link chronic candidiasis, a condition that is known as leukoplakia, which can sometimes lead to oral cancer. So, but don't worry, these patches can completely go away with the antifungal treatment. Sometimes chronic hyperplastic candidiasis might show up because of things like not having enough iron or folate deficiency. So, having issues with the immune system, like there can be other conditions like white patch in the mouth, like leukoplakia, lichen planus, lupus erythematosus, which look similar to the chronic hyperplastic condition, but they don't get better with the antifungal treatment. The next form is Candida associated lesions or denture stomatitis. So it is also known as a denture store mouth, that is a diffuse erythematous and edema of the denture bearing area. So you can see a edema of that near the denture bearing area. So it is common in the people who wear denture. So denture stomatitis, it is basically a red and swollen area underneath the denture. So the swelling and redness often happen where the denture touches the gums. Sometimes people may have a crack or sores at corner of their mouth. That is known as angular stomatitis or angular cheilitis. Interestingly, this condition does not seems to have any age limit, but some studies shows that it may affect women more than that of men. It is most common type of candidiasis related to denture. For example, in study, almost two-thirds of the people who with the candidiasis has a denture-related issue as a cause. Now, other things that could be related is angular stomatitis and median rhomboid glossitis. Median rhomboiditis is a smooth red area in the middle of the tongue, which also fall under this category, but we will discuss that separately. So denture stomatitis is essentially a red and swollen area under the denture that can cause soreness, often leading to cracks at the corner of the mouth. Next, moving to the secondary oral candidiasis, that could be chronic mucocutaneous candidiasis. So in chronic mucocutaneous candidiasis, it is a group of conditions where candida it affect the other portions like skin, scalp, nails, and the mucous membrane. Other form is chronic mucocutaneous candidiasis, that is inherited disorders, probably autosomal inherited disorders. Other form is chronic localized mucocutaneous candidiasis, so that can involve on the occur on the face and scalp. Oral cavity is the most common primary site for typical white plaques, and nail involvement is usually present. Other is candidiasis endocrinopathy, where the endocrine system that can be involved, that is either associated with hypoadrenalism, hypoparathyroidism, hypothyroidism, or ovarian insufficiency or the diabetic mellitus. Other form is chronic diffuse mucocutaneous candidiasis. These are all example of the secondary mucocutaneous candidiasis. Now, how can you diagnose the oral candidiasis? Diagnosis, first of all, you can view in microscopic examination. Fragments of plaque material can be smeared on microscopic slide with potassium hydroxide and examined for typical hyphae. Other is you can do a culture examination, various media that can be used is blood agar media or Sabrods agar media. So which media is used for mycotic diagnosis? It's the Saprod broth media. Apart from that, histological features that can be seen, biopsy samples can be examined under microscope showing the presence of yeast cells and hyphae or the mycelium in the superficial and the deep layer of the involved epithelium. Staining with the PAS or methanamine silver, it helps to visualize the organism. Now, what is the treatment? The treatment that could be given, we give generally antifungal drugs. So, what are the antifungal drugs like nystatin, clotrimazole, amphotericin B, and miconazole that could be used? Nystatin suspensions that are applied to oral lesions have been successful even in chronic and severe cases. However, the tablets of nystatin it can be given for the intestinal thrush that are not effective for the oral lesions. Other medicaments we choose is the clotrimazole, amphotericin B, micoconazole that can be chosen. Now next comes the mucormycosis. What is the other name of mucormycosis? Remember phycomycosis or zygomycosis. So the name of mucormycosis, phycomycosis, zygomycosis. Well, it is caused by saprophytic fungus that is found in soil, bread, mold, decaying vegetations. And now the involvement, you can see the involvement of oral cavity that is can lead to paranasal sinuses or the nasal cavity. So it usually presents with the palatal necrosis or ulceration. So you will see extensive tissue necrosis and invasion of the brain. So mucormycosis, it is a opportunistic infection that affects the people who are weak, who have a weakened immune response. It is more common in the cancer patient, especially those with the lymphoma and conditions like renal failure, organ transplants, AIDS, cirrhosis, diabetic patient, etc. Now there are two main types of mucormycosis infection. The one is the superficial type and other is the visceral type. Now the superficial type involves the skin, ear, fingernails, while the visceral type involves the lungs, GIT tract, and rhinocerebral that involves the nose, sinuses, and the brain. So the rhinocerebral type, it is the most common that is in a dental practice. So infection in the head often happens in the individual with uncontrolled diabetic, and symptoms include cellulitis, eye muscle paralysis, and you can see is the brain inflammation. So the infection it can enter through the nasal mucosa and spreads to the sinuses, throats, palate, eye socket, and the brain. So early sign may include a reddish black nasal discharge, which can progress to tissue damage in the sinuses and eye socket. Well, the mucormycosis it can affect the children from any age, like it can uh, affect the infants as well as the adults. Now, the diagnosis: the doctor can culture specimen on specific agar in a lab, and they can look for the cream-colored colonies that appears within 3 to 4 days. Now, on the examination, under a microscope, you can find this area of dead tissues that are caused by fungus blocking the blood vessels that results in thrombi or the clot formation. The fungus has a thing for blood vessels and can penetrate their walls, leading to the clot formation. So, under microscope, what you can see is the septate, non septate hyphae with the branching at wide angles. So you might see round or oval structures that are known as sporangia. While in distinguishing the mucormycosis from the aspergillosis, the mucormycosis it has a bigger hyphae with acute angle branching, while the aspergillosis it has a smaller septa hyphae with a different branching pattern. So these are the laboratory methods of detecting and diagnosis mucormycosis. The stains that can be cytopathological examination we can use Kumori methamin silver stain or periodic acid pass stain. So next comes the blastomycosis that is also known as American blastomycosis that is caused by the fungus blastomycosis dermat- dermatitis. So the transmission to animals. So these are the clinical features. It is seen in males, middle-aged people, small red papules that slowly increase in size to form abscess or pustules. So these are the clinical features more common in men and than in women, involving the middle age. Begin as a small red papule that progress to miliary abscess or pustule that may ulcerate and discharge pus through tiny sinuses. In systemic disease, you can see symptoms like fever, weight loss, and lung arc can be involved if productive cough is present, similar to the pulmonary tuberculosis. Appearance oral lesions in the blastomycosis they may resemble as those in actinomycosis. Oral infection it can be either primary or secondary to lesion. Microscopically, you will see chronic granulomatous features, including giant cells, macrophages, and microabscess. Prominent pseudoepitheliomatous hyperplasia. The lesion it may show microabscess, and if not ulcerated, prominent pseudoepitheliomatous hyperplasia can be seen. Other is the South American blastomycosis. It is also known as paracoccoidomycosis or Lute's disease. So these fungus can cause South American blastomycosis and leads to systemic skin lesions. The organism can enter the body through the periodontal tissues, reaching the lymph nodes and causing severe lymphadenopathy. Organisms can be detected in the periodontal membrane and periapical granuloma. Extracted teeth can also lead to oral mucosa papillary lesions. The fungi, what it can do is it can penetrate the tissue and establish infection leading to papillary lesions of the oral mucosa. Now, a difference from the North American blastomycosis is the size of the caustic organisms. The fungus in the South American it ranges between 10 to 60 microns, whereas it is in larger in case of North American disease. The next is the aspergillosis. Well, uh, aspergillosis it is a fungal infection that is caused by aspergillosis fumigators that affect the respiratory system. So it involves lung conditions like as similar as asthma. So aspergillosis spore they are widespread and most people inhale these spores without developing the disease. So it will affect the individual with weakened immune response, chronic lung disease, or asthmatic patient. So so it the clinical forms that can be included are the bronchopulmonary aspergillosis, paranasal sinuses, or cutaneous aspergillosis. Bronchopulmonary aspergillosis has the symptoms of fever, breathlessness, productive cough, worsening asthmatic symptoms, whereas the disseminated aspergillosis in severe immunosuppression, it spreads through the bloodstream, affecting organs and causing abscess in various parts like the brain, kidney, heart, and the GIT tract. So diagnosis, you can use a smear that is with the stained with the potassium hydroxide. Grams tend to visualize the hypergelosis which appears septate dichotomously branched that so it shows a dichotomous branching. So in this the branches they will form as a result of equal division of the terminal bud. So the bud it develops into two equal branches. Culture examination like sabrode, dextrose, agar media can be used. Treatment it consists of administration of amphotericin B or combination with the other like itraconazole or amphotericin B in combination with other drugs that can be either used. Next comes the histoplasmosis that is also known as remember it is also known as Darling's disease. So it is caused by histoplasma capsulatum. So this fungi it is commonly found in the birds excreta like the pigeons, blackbirds, etc. So transmission it can be acquired by inhaling dust containing the spores usually found in the bird's excreta. So classification it can include the acute pulmonary, chronic pulmonary or cutaneous, mucocutaneous and disseminated forms. The disseminated forms it spread beyond the lungs to other part of body including oral cavity, especially in the immunocompromised patient. Apart from that, you can see is the organism that may involve the bloodstream causing metastatic lesions like the liver, spleen, and the lymph node. You can see the pulmonary involvement. So diagnosis can be made upon the various smears or direct examination of the clinical smears using stains. Histological features, you will see granulomatous infection that affects the reticuloendothelial system with the tiny intracellular structures of histoplasma capsulatum in the phagocytic cells. So treatment pulmonary histoplasmosis it may resolve spontaneously while the severe case they are usually treated with the amphotericin B. So this was all about the fungal infection.